All right, we are live, coming at you. Well, we're not live. We're actually pre-recording. Welcome to season 2, episode 5, The Juice, aka anabolic steroids, not to be confused with,
Orange juice?
not orange juice. The football player, O.J. Simpson. It's
Oh,
orange juice.
I
Way
did
to
not
throw-
know
way to-
that.
Way to throw OJ at me, yeah. We're hosted by Baron Agostini
¿Qué pasó?
and myself, Dave Deming. So today's topic is a bit interesting. Go to any Gold's Gym or LA Fitness, and you'll definitely see a bunch of guys that are definitely on the juice, so to speak. But really, what we're going to talk about today is metabolism of anabolic steroids, how they're made in the body, the negative consequences. We'll throw some financial data out at you, some pharmacokinetics, or like I said, how the body makes it, how the body uses it, and then a little bit of the types of steroids there are.
It's a slew of them.
Yeah, and then we'll talk about, I actually had a buddy of mine ask me about selective androgen receptor modulators. So basically steroids without having them be testosterone, which is actually pretty interesting. I know they're used in certain cancer treatments. And then we'll talk about certain drugs that are used in the clinic, like Arimidex, potato
banana.
syllable, whatever.
Wrong and fastest on the syllable,
Yeah, I love that. Love that saying. But so what are steroids? Steroids are drugs that are specifically designed to mimic the effects of testosterone in the body, or you can use estrogen, I guess, if you're a transgender. So that would be a steroid as well, but it's called hormone replacement therapy. I know that steroids are actually used clinically for replacement T. I know that you had a bit of a caveat on that. You're like, I don't know about that.
I think it's
But when your testosterone level is 42, at the age of 40, you're not going to feel great.
I don't know. I think it's a weird disease state.
I don't think it is. All right, it is a weird disease state. I just think that I don't think it's necessarily a disease, but I think it's more of a quality of life type of situation where do you want to have foot pain?
Definitely.
Yeah, I want foot pain.
Yeah, I mean, if I don't have to feel like a woman,
Yeah,
I don't want nothing wrong with feeling like a woman, but I just don't want to feel like a woman.
Should I?
So,
man, you feel like a woman?
I just want to have a Cam Newton moment.
Jeez. Lee, you're so from the 1950s.
So here's my thing with that. I mean, like stuff with like androgel is a hormone replacement therapy. You rub it under your armpits, and
There's a lot of negative consequences.
yeah, I mean, like you can hug your kid and
or your wife.
yeah, and the next thing you know, she's got a 5 o'clock shadow because you're rubbing testosterone on her face. Or kids haven't hit puberty yet, and you're hugging these kids at parties. But it's something that you have to be mindful of. A lot of people aren't
I
mindful
know
of
we
it.
always bring this up. We always bring up this TV show, House. That was actually one of the.
Really, that's
Yeah, it was actually one of the plot lines in one of the episodes for House. This guy was on replacement therapy, and his wife or his girlfriend, whatever, was starting to grow a mustache, and his kids were going through puberty prematurely.
like 6.
Literally, like the
Yeah.
little girl was in like kindergarten or something, and she had, I think, she had her period already.
Yeah, which I mean,
But,
normally doesn't happen unless it's very, very rare cases.
So, I think another thing, like they're used to develop muscle, treat developmental disorders. They can be used as a performance-enhancing drug. We know plenty of athletes, John Jones, Mark McGuire, Sammy Sosa. I don't know. Pick a baseball player.
I mean,
pick a UFC fighter. Everybody's on.
I kind of just feel like they should just let all of them use them, and whoever's got the best physician and scientist on their team, may the best.
To be honest with
superhuman
you,
win.
I agree. I honestly agree because at least at that point in time, you're coming out of like the shadows with it, and literally you're allowing these guys or women or anybody to be looked at, by a medical professional to literally have them taken care of if their levels get too high or they have. Because some of the side effects with it is high blood pressure. Actually, with replacement T, it's thickening of the blood, so it actually increases your risk for heart attack and stroke. So
Yeah, especially because of hematopoiesis, which testosterone causes you to produce more red blood cells, which is a problem because if you put more cars on a highway and you're not making bigger highways, which angiogenesis is also associated with testosterone therapy. You see these big giant veiny fuckers at the gym. And you're like, hey, well, how did they get like that? And they're like,
You got
well,
little growths and stuff popping out of their
because they're
So
you know,
actually, you have one of the side effects is tightening of the facial skin. You know, the facial derma, and
I didn't know
that's
that, actually.
yeah. Actually, I know somebody that had that happened to. So it's really not that great. You know, and then what is it? There's numerous examples of professional athletes that have made a career with doing steroids. And I think it was a guy from the Oakland Raiders. His name is escaping me. Where he literally had taken so much HGH and testosterone that he had nodules growing off of him.
Well, HGH works a bit different from anabolic steroids, so I don't want to get too much into that because that alone could be a show and has its own slew of detrimental side effects like cardiomegaly and bone density increase.
Bone gets bigger, look at better
Which,
times. What is it? Sylvester Stallone and Mary J. Blige are on record as saying that they have taken cycles of HGH.
Well, Stallone got caught in the airport with HGH. I don't know so much about Mary J. Blige, but
Mary J. Blige is on the record as saying, yeah, she took it. But like at that point in time, you're an entertainer.
I don't know what you're taking HGH for if you're a singer.
To look better, I guess.
Uh,
I'm not saying that she's the sexiest woman in the world, but
yeah, Mary J.
You know,
Blige. Shout out to Mary J.
but if 50 years old and you want to look good, that's your prerogative. And that's kind of my whole thing with this is, as long as you talk to your physician or somebody that'll help you design this type of cycling, like I'm not giving my approval.
Right.
But if you're going to do it properly, do it as safely as possible, because I think some of the numbers that we're going to actually quote here, like 1 to 3 million people in the United States use steroids, and I think that's just BS. I think it's much higher than that.
Probably. I mean, it's probably one of the underreported things because it's illegal to do.
A, and then B, there's such a stigma against it in today's culture.
I mean, rightfully so. I will say because, well, for one, let's just say this. All this paper that you probably can't see that is on this desk are notes, clinical studies. Most of it has nothing to do with anabolic steroid use for performance enhancement. I mean, that's something we don't study.
Well, actually, the German Republic, when it was East Germany.
German Republic? Yeah, I meant we as in like the United States, but yes, this is an interesting story.
So the USSR obviously doped up their athletes to the point of like, Jesus Christ, just look at them. But during the Soviet era,
Who's the guy Rocky fought in Rocky 3?
Drago. Yeah, look, like that's just one of the pop culture
That's a little,
references of basically how often they got popped for steroids.
That's
But there was a lot of good research done on these athletes that were taking all these steroids and everything else that we do have an idea and a sense of how bad or detrimental they can be, or how positive you can have an impact on the body.
I mean,
by
we
doing
know that here's the reality. People do anabolic steroids because they work.
Yeah.
That's
Bingo.
Let's be clear there. This isn't herbal supplements. This ain't ginkgo biloba extract. This ain't green tea.
Stepping back to our homeopathy and alternative medicine episode. Yeah.
This is a hormone or a hormone derivative that increases your body's ability to take all the nutrients that you consume and devote it towards muscle
Bingo.
recovery,
Yep.
strength, vascularity, you name it.
There's a steroid that you can take to increase any of it.
Yeah.
What is it? Winstrol, Tren.
Yes, the Stenazolol, which is something they used in the Olympics back in the day. So, I mean, the reason why I want to get into, aside from the stuff that East Germany and the USSR used to do, the clinical uses for anabolic steroids are nowhere near the range that bodybuilders use steroids.
No,
and
of
I
course.
kind of get into this conversation with a lot of bodybuilders all the time who are consider themselves experts because they've been taking steroids for 30 years, and then these guys have heart attacks or die or whatever the case would be, and they're like 42, and they're like, "Wow, he was in great shape. He ate healthy. What happened?" You're using anabolic steroids for
ventricular
40
hypertrophy.
years. Like,
Yeah.
what do you think is going to happen when you're using something up at the upper echelon of where your body can deal with? So, as
And
Dave
then-
said, if you're going to do something like this, which doesn't have absolute or strong clinical data behind what can happen to you, you definitely need to have a close-knit relationship with a physician if you're going to use testosterone.
Yeah, clearly. And then the other flip side to it is it's very toxic, especially the types of steroids there are. If you do an oral, like Diranabol, that has first pass through the liver. So it's really hitting you twice because you're going to have to metabolize it first to make the active metabolite. And then subsequently after that, that metabolite has to be broken down again by the liver.
Well, I've got a note here. One of several thousand associated with this. Also, there's just so much literature on this shit. It's
Literally.
we're gonna do a write up because we can't cover this in like 45 minutes. One, because the science behind this is also very interesting and very dynamic. But like they were saying about oral steroids, so your body doesn't like ingesting hormones.
No, kind of.
It just doesn't want to do that. It's why plant hormones and animal hormones don't turn you into a cow or a moose or whatever the case. Your liver does a great job of taking whatever you ingested and destroying the fuck out of it.
Mm-hmm.
So to do that, or to stop that from happening, us science people have done something called an alkyl substitution, which prevents deactivation of the steroid by first pass metabolism by sterically hindering oxidation of the 17B hydroxyl group. Meaning that we take that's a carbon on this big molecule at the 17 alpha position, we then alkylate it, and that stops your liver from turning it into bullshit.
Yeah.
And when your liver can't do what it wants to do with the drug, it's really stressful.
Yeah, it's toxic.
So a lot of times drugs that are not easily metabolized increase liver enzymes, and that's one of the reasons how we know that these things are bad.
And
for
a
your
lot
liver.
of the problem is a lot of people who do take steroids are, I don't want to say addicts, but they're more prone to risky behavior. So a lot of people take steroids and then drink on top of it or do other nasty things to their liver, like Lee was saying. And it's a double whammy in a manner of speaking.
Adverse reactions associated with the liver. Impaired function, first and foremost. If you're on anabolic steroids at any given moment in time, your liver does not function as well as if you were not. That's not saying that it doesn't function, or you may not even notice that it's not functioning. But apples to apples, person A, person B not taking anabolic steroids orally, it's going to have better liver function than you are.
Oh, I see you have the table. That's up
I have
there.
the table here. Hepatic cholestasis, bile canal obstruction causing jaundice,
So
which is yellowing of the skin.
It's when you get a gallstone and it clogs it up.
I don't know what pileosis hepatitis is, but it's blood-filled sacs of the liver. Yeah, that sounds delicious. I love that.
No liver tumors, that's obviously a risk. But cholestasis, that's actually really painful. So, yeah.
I've never had a cholestasis because I don't do anabolic steroids. But
Me either.
I mean, most people that do anabolic steroids don't get cholestasis. But I mean,
But you have adverse events. So.
people smoke and don't die. But I'm not an advocate for
I'm not going to go and smoke a pack of cigarettes a day. But, so I want to ask you, so what do cholesterols have to do with this? So basically,
Well, Dave, I'm glad you asked that.
so cholesterols are a normal part of the diet. Your body needs cholesterol to make steroids.
Your body also
It
makes
actually needs-
cholesterol.
What's up?
Your body also makes cholesterol.
Oh, yeah, it does,
Most of
yeah.
the cholesterol comes from that. So EX is fine. Don't worry about it.
Yeah, exactly. But you can actually have the statins can actually reduce the amount of steroids your body makes because it reduces the amount of cholesterol it's
yeah.
making. So that I'm not saying I don't know if there's a connection between taking statins and reduced T, but you never know.
You know what? We should do a show on statins because they're, aside from what their purpose is, they have been used in like a lot of clinical trials. And a bunch of stuff is associated with them. But yeah.
So I just want to point out that here's a base cholesterol molecule, and it gets turned into via different enzymes, especially cytochrome P450. There's a bunch of different cytochrome Ps, like 11, 12.
Yeah, and the cytochrome Ps are
21.
enzymatic pathways that pretty much chew up drugs and turn them into shit that doesn't want to hurt you.
Exactly. So when Lee was saying that they add alkyloid, the beta 17 position,
Right.
you're basically making it more into a hydrophobic molecule instead of a hydrophilic molecule. Because the way that your body usually goes through ADME is by taking, goodness gracious, drugs that are, or any xenobiotic, and making it less hydrophobic and make it more hydrophilic so that it can go through the other steps of
Yeah, so the
metabolism.
more hydrophilic a drug is, the easier it is to eliminate. So your body tries to do that to everything because it wants to pee it out.
Yep.
But to get into cells, you need to be as hydrophobic as possible to get past the cellular membrane, which is made up of lipids and proteins.
So that kind of brings us to, I just wanted to touch on the different types of steroids real quick.
All 1,700 of them?
Yeah, Jesus. No, I mean like just overall. Like you have your sex and your anabolic steroids like testosterone and estrogen. Everybody knows about those. But a lot of people don't understand that, the adrenal glands and the adrenal cortex makes glucocorticoids and mineralocorticoids, and these things regulate, they're basically stress hormones. So if your body needs to retain more water or retain more salt or potassium or chloride, it'll release mineralocorticoid steroids, or you can actually be prescribed prednisone for inflammation and different things like that. So your body makes all different types of steroids, and there's plenty of medical
glucocorticoid, not an anabolic. Just to make sure we're having a distinction there.
So basically, anabolic or catabolic, whatever, is more along the lines of building stuff up and breaking them down. So in this case, you're going to be making a bunch of proteins. In the case of testosterone, such as building up muscle. With estrogen, it does your female sex characteristics. But however, it's kind of like the opposite. It's like yin to the yang. So I don't know. Not all steroids are bad.
Right, yeah. Not all steroids are bad. No, because the type matters. Mm-hmm. Like, not all carbs are bad because there's different types of those or fats or whatever the case may be. But on some positive notes, at least, where are we at now? We still
some types of steroids. Yeah. So there's testosterone. There's DHT, dihydrotestosterone.
Isn't that associated with like balding or something like that? Or?
Yeah, honestly. But it's also what 5-alpha reductase breaks down regular testosterone in muscle, skeletal muscle, your prostate, your testes, everything. And it's actually the active form of testosterone in the androgen receptor level. So you have DHT binds to androgen receptor and does all the transcriptional activity that the androgen receptor does.
Just a little biology, biochemistry here. How testosterone works is this little molecule gets into the cell, gets manipulated slightly, and it binds to a receptor. That receptor then has a signal transduction that turns on specific genes inside the cell. And through this difference in transcriptional programming is how you get the effects, right? Mm-hmm. So take steroids. Steroids tell your body, use everything that you eat for getting swole.
Getting swole.
I mean, they only do that. They don't only do that, but wound healing, wasting. I mean, they're huge in metabolism. I mean, the physiological effect that anabolic steroids have is why we see performance enhancing. The performance enhancing pretty much criteria is pretty much the promotion of creating structures and as far as like your muscles are concerned. So.
And actually, just a side note, a lot of drugs with prostate cancer block DHT from binding to the androgen receptor, or kind of keeps the androgen receptor sequestered in the cytosol, or the non-nuclear portion of the cell, where it can't actually do the transcriptional upregulation of these genes. And it actually kind of reduces, the spread of the prostate cancer, or the growth of the prostate cancer, or aggression. So,
well, just a quick cancer reference, prostate cancer, like many types of breast cancer, can be driven by the sex hormones. Prostate cancer can be driven by testosterone. Just as breast cancer can be driven by estrogen, which if you're a cancer and you're in the breast and there's a smorgasbord of estrogen running around, it's probably a good idea to use that as a factor for you to grow. Same thing with the prostate.
It's kind of like me in a buffet.
I'm
just going to go nuts and growing it big. But just keeping it light a little bit. I know it's cancer, but
Right.
We work with cancer all the time, so it's kind of second nature.
But scientists are horrible at
real jokes.
Taking real problems.
But so there's many different types of steroids, but the main one that everybody talks about is testosterone. But there's test CYP, there's test ethanoate, There's sustanol, and those are just different modifications on the testosterone.
So those
Like
those are injections mostly. Usually they're dosed once a week or bi-weekly or something like that. Pretty much that's as close to you can get to natural occurring testosterone. Your body treats that as if there's just a surplus of testosterone, and because your body knows that it shouldn't have this much testosterone, it actually stops your testes from making testosterone because there's an exogenous.
And then people will actually take what's called clomidine or Novadex to actually increase the natural production of testosterone by, I believe it's the Leydig cells. Leydig cells. Or sertoli cells.
Yeah, my testicular anatomy is not
I think it's Leydig
great.
cells.
So we get some Googlage on
Yeah,
that.
we're gonna get some Googlage on that.
But yeah, so actually there's a common thing as far as associated with the size of your scrotum when using testosterone.
Leydig cells.
These types of steroids will make your balls smaller because your balls are
Because it comes down.
glands.
It comes down to the hypothalamus, pituitary, testosterone or ovary axis.
Yeah, I mean they're less
Right.
active, so they get smaller.
Yep. So basically,
Because small balls axis.
yeah. So basically, what it'll cause is luteinizing hormone to be reduced in quantity and production in the pituitary because the hypothalamus is regulating that. Because I think it's a follicle stimulus? No.
What it has to do with just the sheer testosterone blood concentration.
Yeah.
So it's a negative feedback loop.
Yeah.
The more testosterone in the blood, the less luteinizing hormone you make. When you're injecting 100 milligrams a week, which is like 5 times the amount of testosterone your prepubescent basketball, football, raving mad girl, crazy teenager makes, your body is like, I need to not make testosterone,
And it's actually going to increase other different enzymes such as aromatases,
which turns testosterone into estrogen.
Exactly, and that's why a lot of bodybuilders or gynecomastia
Get man boobs.
get man boobs, or you are impotent. You can't actually get hard because the estrogen levels are too high, so it doesn't actually allow you to have what is it?
We have
calcium
decreased
signaling,
libido.
NO signaling to calcium signaling in your penis to actually stiffen up.
It's
So-
okay, we can say penis. For science, it's educational. Penis is an okay word here.
It's called erectile dysfunction.
But I will say this though, if anybody you know who is using testosterone, almost indefinitely when they're taking testosterone injection, they're coupling it with cycles of Arimidex to avoid gynecomastia.
Yep.
And if you're not doing that and you are using testosterone, please use Arimidex so you don't get gynecomastia, because once you get tissue in this area, it just doesn't go away. A lot of the times there's surgical rescission associated with once you have gynecomastia. So
You don't want man
Again,
boobs.
I'm not an advocate for you taking drugs without any clinical or medical knowledge, but if you're gonna do that,
Do meth. So if you're gonna do drugs, whatever. I don't care. I'm not you. I'm not gonna make that personal decision for you.
I don't like you to be informed when you make poor personal decisions.
Exactly. So I'm also not advocating for you to go and drink a fifth of vodka, but if you drink a fifth of vodka, don't drive.
Right, if you're gonna do that,
Do it like
do it
someone
in the safety of your home with a toilet nearby, or water, chaser,
some
things like
Pedialyte.
I'm not advocating.
But so mevalonate pathway. So it's basically how your body builds up to make the components to steroids, and it basically uses, also known as the isoprenoid pathway or HMG, acetyl-CoA reductase pathway. It's an essential metabolic pathway present in eukaryotes, archaea, and some bacteria. Pathway produces 2 5-carbon building blocks called isopentenyl pyrophosphate, IPP, and dimethyl pyrophosphate, which are used to make isoprenoids, a diverse class of over 30,000 biomolecules such as cholesterol, heme, vitamin K, coenzyme Q10, and all steroid hormones. So that's basically saying it takes I know about acetyl-CoA, but I don't think the audience knows.
Well, if
about
you're watching this, you
acetyl-CoA.
probably know about acetyl-CoA,
Fair.
Krebs cycle, energy, fatty acid metabolism.
Yeah, beta oxidation. Basically, it's your building block for either producing energy or producing. You can make amino acids from it. You can make glucose from it. You can make a whole bunch of different things from it. But it also goes into making all the steroid hormones. So I just
Actually,
wanted to
acetyl-CoA is also used to carry acetyl groups for histone acetylation.
Yeah.
So it's got an epigenetic type thing.
of epigenetics.
So, but I will say this though, on a positive note, because we're just really bashing shit of anabolic steroids, but they do have some fundamental great clinical uses. And the reason why you can even get these things in the U.S. is because drug companies make these things because people.
Well, actually, the United States market is flooded from Mexico.
I mean, in the
Russia.
black market.
Yeah.
Yeah.
I get that. But at the same time, you can get these things through prescription. I know my father got diagnosed with low T, so he had.
I mean, you can get all of these oral steroids through, like, Anadrol, oxandrolone, stanozolol. I think stanozolol got discontinued, but Anadrol 50. All of these are prescription drugs in the United States. As far as the black market is concerned, if you go and Google this shit and you order some testosterone to your house, one, I don't know if you're going to get what you want.
Nope.
Two,
It
people
might be
do
tainted.
stings associated with trafficking testosterones because it's a controlled substance in the U.S. It's like ordering Xanax to your house, which I'm sure some of you probably do.
I think it's like a Schedule 2 or Schedule 3 class.
Nah, Xanax is a Schedule 3. So
Yeah,
is
is it?
Yeah, it's not Schedule 2.
I didn't know that.
Yeah, no benzodiazepines are Schedule 2.
That's
Yeah,
interesting. I didn't
only
know that.
opiates and amphetamines.
You know what's funny? Marijuana's a Schedule 1, but cocaine's a Schedule 2.
Yeah,
Go figure.
true.
Because cocaine.
Well, you
is
use it for
used-
nasal surgeries.
Yep, and certain oral surgeries as well, which is kind of interesting.
I mean, this guy serves a clinic. I mean, drugs serve purposes. Just because they make you high as well doesn't mean they don't have some
Clinical value.
pharmacological
just like
use.
anabolic steroids, apparently.
Right. So, in cases in which people have used, or clinical trials where they have been used, obviously, hormone replacement therapy is the most common use of testosterone in the United States because people have low T or they're just being big bitches.
My dad's gonna kill you.
But HIV patients, people with
Wasting
hepatic
disease.
renal failure, chronic cachexia, which is like muscle weakness, COPD, which is chronic obstructive pulmonary disease. So yeah, all these things happen, right? And so in HIV infection, testosterone replacement is commonly used because part of there's something called HIV like wasting syndrome, which I'm not exactly sure how.
The disease causes you to lose a lot
Yeah.
of weight. Really.
I mean, I'm not sure about the mechanism of why the weight just kind of you turn into this very like I don't know what to like heroin look. I don't know. You just get really
you
skinny, and some people get this and they don't have appetites, and it's very hard to get weight on them. So we give them anabolic steroids, low dose, and it puts weight on them for obvious reasons, right? Because anabolic steroids turn you into a muscular freak of nature, which we all want to look like. No, that's not true. These patients don't necessarily turn into the Hulk because the doses are mediated. But a lot of the times once you rebound out of HIV wasting disease, a lot of these patients do end up becoming more athletically sound because testosterone kind of allows you to do that.
I wanted to touch on this little fun fact is that in a 2007 study demonstrated that 74% of all anabolic steroid users for non-medical purposes, so people buying these things off the black market
Or getting them prescribed
or
for
non-medical uses, such as Derek Jeter and Peyton Manning and all those fun guys.
deer elk
Deer elk and
sleeve or some shit. I don't know.
antler.
Antler.
Held post-secondary college or university degrees. So 3/4 of these people are highly educated in a manner of speaking.
Yeah.
So they think, I don't know, that they're smart enough to take them, that they, I don't know, they kind of figure out how the level of dosing, how much to take. They'll schedule out over the course of 3 or 4 or 5 months or whatever. This is what they have to do. They'll build it up and they'll break it back down and they go by the numbers.
Yeah, I mean, the thing with this is like if you look at, so firstly, most, except for football, most athletes and your home run hitters in their late 80s and early 90s, most of these guys aren't really big, right?
No.
They're athletic, they're muscular, but they're not really big. And usually the problems with anabolic steroids, as far as the users are concerned, come from the guys that are like 5'10" and you're 310 pounds and you're 3% body fat, and
Jesus.
you're eating a chocolate cake for lunch or something like that because you're trying to get your blood vessels dilated. I mean, like, just being that weight alone has risk factors associated with
Oh,
it.
yeah.
So
You could be 10% body fat, 290 pounds, and you're still going to have heart issues. Like, you're going to still have risk for diabetes, you know, because your body's not meant to be that big.
it's definitely not meant to be that big when you're using testosterone because it's I mean, look, it's like this.
So basically,
Cars in the U.S.
anything
only
is
go
okay.
like 120 miles an hour or whatever like that because they have governor's limits on them. And pretty much that means if you buy a car from a dealership, unless it's like a Lexus or some shit, get a Toyota, you're not going to go 150 in a Toyota. And it's because they won't allow you to go 150 in a Toyota. Your body kind of says, hey, look, you're going to plateau, right, based on how much food and energy and how much your body's willing to sacrifice for that type of energy response and that muscle building response. Testosterone takes all of the limits away. And a lot of the times, a lot of people that are very athletic or into bodybuilding, you know, testosterone use kind of comes as this window of opportunity to get over this plateau that they're experiencing.
And a lot of problems with that is that you'll tear muscle, you'll tear ligaments, you'll actually
Triceps, torn pecs.
And it's
These
not
are
even
common
just-
bodybuilder kind of injuries.
It's not even just muscle though; it's the joints and, you know, like aromatics. The big side effect for that is wasting of the joints. Basically, you lose, you know, the cartilage in that joint, and you're going to just rub. It's basically taking out the oil in a joint in a car.
And it's likely because estrogen probably has some protective role there.
I don't know the actual mechanism, but I do know that it's one of those things that when breast cancer patients are given aromatics to reduce the amount of estrogen in their bodies, is that's one of the symptoms of, you know, overdoing it or overdosing, is that your joints start wasting away. But all these steroids aren't just necessarily giving you like ventricular hypertrophy. That's one big one. Basically, you're building muscle, but you're building muscle in your heart to the point where your heart is going to freaking explode. You know, the ventricle is the part of the heart, the chamber of the heart that actually pumps blood through either the lungs or through the rest of the body.
I mean, it's the bottom part. It's the part that's actually giving you the oomph. The atrium is more of a holding place
It
for
just
blood.
pumps it to the next chamber and goes. But, you know, I don't know. It just...
Here's the interesting thing. Women use testosterone too. CrossFit and all that extra shit. Let's check this out. Growth of the clitoris.
Okay,
Hey.
here's a fun thing to Google. Google bodybuilding clitoris.
I don't think you should Google that. It's not safe for work.
It's definitely not
Definitely
safe for
not
work.
safe for work. Don't get
But-
fired because you watch the show. Secondly, this
But
is
if,
kind of
if
a,
you want to have a really, really bad image in your head, go for it. If somebody told me to do it, it's still stuck in my head from
yeah,
a
and
decade.
it's irreversible. Unlike the shrinkage associated with testicular atrophy associated with using injecting testosterone, where you pee. So this is like a misconception, right? Because most of the anabolic steroids, especially the oral ones, have no effect on the penile stuff. And if you actually give a kid anabolic steroids before puberty or just entering puberty, it'll make his meat bigger. Which
I like how you said it'll make his meat bigger.
I like
First
how I
off,
use the
it's
clinical
just-
terminology. Make his meat bigger. Yeah, but I
His
guess
penis will be enlarged.
his penis will be enlarged. You have an enlarged penis if you use anabolic steroids in your teenager. It's an observation. People
So
don't do that.
it's just, I don't know. So let's just talk about how many the U.S. adults think that at least 23% think the NFL 23% of NFL players use anabolic steroids and 26% for the MLB. I think if you updated this a little bit more recently, it'd be a little higher due to all like the reporting that's coming out, especially with the UFC. I think everybody in the UFC is basically on the juice. It's just basically how they get away with it. And it's
I don't
not
know.
necessarily going to be things that are on this list,
Right.
but it's going to be other derivatives that aren't going to pop hot in a piss test or in a blood test.
Right. So
So
we have a
that's the
list
thing.
here of marketed and approved. Well, if they're marketed in the U.S., that means that they're FDA approved drugs, steroids, anabolic steroids. And then there's a whole blacklist of drugs that are used for anabolic steroid use, and they haven't been marketed and haven't been approved in the U.S. And that list is almost twice as long as the approved list. But
Jeez.
also, some of my bodybuilding friends from back in my Miami days would bring this up all the time because oxandrolone is like a beginner's oral steroid, and
Is that T-ball?
no,
That's Diranabol.
Diranabol. What's the brand? What's the street name for oxandrolone?
I actually don't know. I'm actually going to Google that.
Give me some Google on that. Anyhow, so there was a clinical study, and a study of 273 patients with moderate weight loss due to alcoholic hepatitis.
Jesus.
These people have the worst liver function. Oxandrolone, 80 milligrams a day, improved hepatic function and nutritional parameters, and increased 6-month survival with compared. Anavar. There we go. Anavar. Yes, the beginner's guide to oral steroid use. Although this was considered a preliminary study, it showed that use of anabolic steroids, including oral agents, can be useful in even some types of liver failure associated with weight loss. Again, don't get me wrong. There are limits associated with how much of this drug you can take, where it becomes negative impact on the liver.
The dose makes the poison.
The dose makes the poison.
You can drink as much water in the world as you want, but you're going to hit a limit. You're going to die from it.
Also, just want to say that the criteria for this study was people that have protein calorie malnutrition.
Oh, jeez.
So this is why we're giving them steroids.
Because I need to eat.
Because,
to
yeah,
stay alive.
but, I mean, a lot of these drugs, and Anavar is, I mean, 80 milligrams a day is actually nothing compared to, people are taking 200, 300 milligrams of Anavar a day that are in the, they're like off-cycle Anavar.
I've never really.
Yeah, like
Jesus.
off-cycle is Anavar.
Actually, I've never met anybody that's taken Anavar, or actually has openly said it to me anyway. So God knows. But
You know, steroid use is very fluid, and I mean, I'm from South Florida, and yeah, people use steroids all the time. It's not like a
I actually know a guy
taboo
that
thing.
wants to get as big as he can possibly get. He's one of those guys that started out maybe 180 pounds when I first met him. Now he's up to 280. He's
Yeah.
bench pressing. He's incline pressing 455 for sets of 8 or 10 or whatever on his Instagram.
I knew this kid.
He had, no, let me finish. Guy got renal failure. Was in the hospital for 3 weeks because of overdoing it on the steroids, and he's back on the juice again because he can't stop. He just wants to get as big as he possibly can. At some point, you know, something's got to give. So it is what it is. But
Well, speaking of renal stuff,
kidneys, renal kidneys.
I have a study here. So patients on hemodialysis, a double-blind, placebo-controlled study. So
Ooh, coming back to next week. Last
the
week.
golden goose of clinical studies of 29, the number is really low here, of 29 dialysis patients receiving either nandrolone or placebo, 100 milligrams a week, for 6 months, showed significant gains in LBM and functional parameters. LBM is kind of like a measurement of kidney dialysis function or whatever the case may be. Studies also indicated that the erythropoietic effect, meaning your ability to make red blood cells, of this drug is useful in chronic renal disease, and that anabolic steroids used in combination with recombinant human erythropoietin, which is also called Neupogen or EPO, makes you make more red blood cells. Kidneys have a huge impact on the amount of EPO that's produced.
So your hematocrit goes up.
Right, and the gains in hematocrit are greater than either agent used alone. Again,
Damn.
these people have a severe disease state, and in a clinical setting,
Need this drug.
not only they need it, but we're monitoring how much this is being used. 100 milligrams a week.
So
I don't know what the street market,
I don't
street
know how much
drug
that is.
use, and all my steroid scholars. I'm almost certain, I can be semi-certain that maybe it's 2 to 3 times
At
this amount.
least that. At least that.
Because every drug that I ever come across on, and I talk to somebody that does anabolic steroids, and I'm like, oh, well, what do you use? How much of this do you take? And they're like, oh, I take like this. I'm just like,
Damn.
that's like 4 to 5 times the recommended dose that I've seen in the
That's
upper
like-
limit of clinical
That's like
trials.
taking prescription level ibuprofen is 4 of the 200 milligram tablets that you usually
Yes,
get
800
like
milligrams.
your Motrin or Advil.
3 times a day.
And that's basically like going, I'm going to take 16 of them at a clip. And then, I'm going to take another 16 in 4 to 6 hours.
Well, here's a great example.
That will kill you.
I get migraines a lot. Ibuprofen is a non-steroidal anti-inflammatory drug.
And said,
And it's used to reduce inflammation, right? And
you don't drink on it, do you?
no,
Okay.
right. So the reason why you asked that and the reason why we said it was because non-steroidal anti-inflammatory drugs can cause bleeding in the stomach.
Doesn't it? Oh yeah, the acetaminophen is kidney.
Right. Liver.
Is it liver?
Acetaminophen is liver.
Okay.
NSAIDs, naproxen, atodolac. There's a bunch of these drugs. They actually can cause ulcers and the gastric. And it's because they inhibit prostaglandin synthesis. Prostaglandins are used to coat the stomach. So blibbity blobbity. Anywho, if you're a normal person and you're taking 2 Motrin when you get a headache or whatever the case may be,
You can even take
You're-
up to 4 Motrin.
you're fine.
You're
Yeah.
fine.
If you take 8
No,
Motrin every 3 hours,
you're fine.
your stomach is you're gonna bleed out probably. And testosterone and any other drug is the same exact way. There's a therapeutic window in which you can use these drugs safely. And by all means, I am drug
I don't want to call myself
promiscuous, I guess. I mean, I'm all for people.
But you don't take drugs.
I don't.
You
But my
take
mentally,
alcohol. Like,
but
you take
mentally,
alcohol
I'm
by
not.
the gallon, I guess.
I'm not anti-druggies, and I'm all for people, biohacking to the best of their ability. The best
So
science.
my whole thing is, I'm of the belief that, like we said earlier, is that you should be able to take steroids if you're a professional athlete to increase your game, but under the supervision of a physician. Because I want to see more home runs, I want to see more touchdowns, I want to see people be able to run faster, jump higher, and yada yada yada. How do you feel about, say your MD getting straight A's through medical school, taking Adderall?
How do I feel about it? It fucking sucks because I was in class with this guy and he was killing the curve because I wasn't taking Adderall. So,
However, would you rather somebody who took Adderall to be the best that they could be, or would you rather somebody who took nothing and got C's and doesn't know jack diddly squat?
here's my thing, right?
I don't know. I want the best of the best.
My
so-
thing is that if
or another neurotrope. It doesn't have to be Adderall.
Right, it could be anything.
But that's just the most prevalent
right.
in
Let's say
society.
it's Adderall or what's that other Vyvanse, super popular.
Ritalin.
Yeah, people don't usually take Ritalin off the drug like normal. People are scared of Ritalin.
So Adderall is more like meth, literally methamphetamine,
Yeah, plus or minus.
because it's
some groups.
dextromethamphetamine or dextroamphetamine, methamphetamine. But there's been clinical psychiatrists that actually have done studies on people, giving them meth and giving them Adderall. Like, they didn't go up to the general population and go, "Hey Lee, I'm going to serve you meth or Adderall." They actually gave former or meth heads or people that have admitted to doing meth Adderall, and they get the same high out of it. So
Yeah, I mean,
it's in.
Don't get me wrong,
But,
the thing is that the
Ritalin
street-
is cocaine. It's just a certain derivative off of cocaine. It's very similar in structure.
I
Chemical
don't know
No,
because I thought Ritalin was an amphetamine, but
it's more similar to cocaine in terms of structure.
so I'll run with you on that one.
I learned that from The Simpsons.
But
But it
but
doesn't change the fact that it's correct.
the problem is when people are doing meth, you can be doing a gram or 10 milligrams. Like
I don't
who
know.
knows? I don't know how meth is sold. I mean, I guess it's sold by weight like everything
I'm
else.
assuming
I don't know
grams, I
concentration
guess.
of meth you're smoking at any given times, and this is the reason why people have negative impacts associated with drug use, because the cocaine that you sniff, if you got it from Juan, I'm only saying that because most cocaine comes from Colombia or Bolivia.
I was going to
If
say
you
it's kind of
Most cocaine comes from these countries. So if you get it from there and it's like you got to connect and it's probably really uncut, it's probably really potent. You
But it's the
can
additives.
die. The additives, well, listen, cocaine can stop your heart alone
It does.
in its pure form.
It,
You can
it
die.
kills heart cells.
So, but how much you're doing at a time is, it all goes back to how much
The
and the
dose
dose.
makes the poison.
Pharmaceutical drugs, you know exactly how much you're getting. You know exactly how much is being eliminated. You know exactly what the half-life is.
The problem with weed edibles in the states that it's legal for medicinal purposes, you actually
You
know
don't know what the fuck you're getting.
how much is in it. Yeah,
It's
kinda
like,
messed
oh,
up.
weed brownie, boom. Comatose. So, I mean, also please, I'm all for the whole edible industry, but squatty bobbity.
Yeah.
Please get some more regulation over there so we don't have people eating edibles and fucking passing out in the middle of the street.
All right. So any final words on steroids?
Final words on steroid use.
Juices for life.
Roid rage is kind of a myth.
Kind of, but not necessarily. The way that they make it seem is like with marijuana, with what was that? Reefer Madness.
Reefer Madness in the
No.
80s, yeah.
30s.
30s or some shit.
Did you not read the article I wrote about marijuana?
Yeah, I remember. It was a throwback, yeah. I was thinking Reagan years.
However, you can cause your increase in aggression levels, but it's not necessarily you're literally all going to throw chairs against the wall. It actually can have the opposite effect of roid rage. It can actually be a leveling experience for some people.
A lot of people experience decreased libido associated with testosterone use. So, I mean,
Does different things to
yeah.
different people.
The thing is, look, if you're a mild-mannered Peter Parker, testosterone is not going to turn you into Venom.
No.
It's in every movie ever. Always shows the guy that uses testosterone is flipping out and raping some chick
Jesus.
or losing his. Listen, if you're mentally unstable before testosterone, it's probably not going to help because you're going to be really energetic and strong as shit. And you, the reason why it's controlled and addictive is not because there's an addiction mechanism associated with testosterone, but people get addicted to the results.
Mm-hmm.
Like,
or the feeling, when you get that pump or that swell or whatever. It's a secondary effect. It's not like you're going to shoot up heroin and all of a sudden you feel great. I'm assuming.
I mean, so I guess
I'm assuming.
I don't know. I'm assuming people feel great when they do heroin. That's why people do it.
Do heroin.
Yeah,
but that's that's a different type of different type of high, I guess. But
yeah, I mean, just from a pharmacological perspective of how addiction works, testosterone doesn't bind to anything that causes an addictive, like, physiological position. So, but like I said, addiction is a psychological aspect as well. If I get really good at ripping tables apart and testosterone helps me do that, I'd like to.
I want to rip tables apart.
Yeah, I'm not even sure if that's possible. I'm pretty sure somebody below can do that.
Perfect.
I've never ripped a table apart.
So my final word on this is, if you're going to do it, try to do it as safely as possible. Find somebody that isn't like the freaking guy in the gym, in the locker room, and be like, hey Lee, you want a couple
His
meals?
name's usually Mike.
Or, yeah, it's definitely, or Jared. I feel like those are like some
I don't
scummy
know.
names.
I feel like Jared is automatically associated with pedophilia now because of the Subway dude. Yeah.
That was a reference in the latest Family Guy episode too. God damn, that sucks. But try to find somebody that you trust as like a physician level. Somebody that works in biology, somebody that actually knows the hell is going on with it, and do your own research, do your due diligence on it. But literally, try not to do it. You can get gains, and you can hit if you hit a plateau. Like I went back to last week, find a personal trainer that's actually knowledgeable about how to get past those types of things. If somebody that has a high level certification, there's now it's a way different atmosphere or type of environment where you can actually go and find different ways to overcome these types of things.
I mean, the reality is that if you want to be competitive in professional bodybuilding, you won't survive without doing tests. Like from a competitive perspective.
In terms of competitions, there are leagues that do just
Yeah,
steroid competitions.
and
There are
there's-
also natural.
This
leagues
is
as well.
the thing I'm saying though. They had to create a natural division for
Yeah.
people that aren't using tests because they know they can't compete with people that are using testosterone. So, which I mean, give me a break.
All right, what's on deck for next week? I think we have to come up with a couple.
I think we come up with a list, right,
yeah.
for stuff.
So we're going
like,
to be coming
take
out with a
suggestions.
schedule. If you have any suggestions, please message us, Facebook us, Instagram on Lee the Scientist.
Scientists, please.
Hit
And
us up on bioislifemedia.com. And just let us know what you guys are interested in. I know that I want to do homeopathy. I know that we have a whole list of different things that we were saying that we wanted to hit. Maybe we should do another cancer episode.
I think we should do some drug addiction stuff.
Yeah.
Because I as a person in the clinical space, I hear non-clinical people talk about addiction like it's your fault. It's like it's not you don't have a disease. You're a weak person. That's why you're addicted to meth.
I think
And I'm like-
I think it has some personal choice, but at the same time,
Oh,
it
of
definitely
course.
has a
Right.
physiological response mechanism.
Of course, it's
So
a personal
let's,
choice.
let's do addiction next
Let's
week.
do addiction next
All
week.
right, so everybody, thank you for joining us. We will be seeing you next week. I think we're going to toy around with whether we're going to do a live format again or if we're going to stick with the pre-recorded format. Let us know what you guys think, if we should do pre-recorded or if we should do live.
Again, comment, send us your questions so
please.
we can respond to you.
All right, everybody. See you next